definition. One of them was oxygen carrying capacity in blood. There was variability in the answers. Now, the majority of you answered it correctly, but a lot of you missed it. So let's say you have a condition where your oxygen carrying capacity is low. What would be one possible thing? Talking about just measuring the blood. What would be one possible thing why you don't have as much oxygen in your blood? Anemia. So that was the condition I was looking for. Now, I saw some variability, and it makes me concerned. For example, let's go with thrombocytopenia. Why would you select thrombocytopenia? Or more specifically, what are thrombocytes? What are thrombocytes? Platelet. So that would have nothing to do with oxygen carrying capacity. Another one selected was leukemia. I think you guys now remember what leukocytes are. Hopefully by the end of this chapter, that could never be a solution. And leukopenia would be the same thing. Neither one of which has, basically, there was no chance that any of the other possible solutions were oxygen carrying. But when I saw people selecting the other ones, I said, it makes me wonder if they understood the basics. So that's a really important one. When you think about what's predominantly carrying your oxygen, that would be your red blood cells, your erythrocytes. Another question that I think some people may not have spent as much time on was just really looking at the plasma proteins and the composition of what a plasma protein is compared to where you might find hemoglobin. Is hemoglobin a plasma protein? No. Why not? Because it's in red blood cells. So that's good. I think the question over blood clotting was missed probably because people just didn't review it. So the stages of blood clotting, I would recommend that for those of you that maybe were a little uncertain on your choice, you review that. And I am going to talk to you guys about the process and things like that in a moment, but we're just going to go through questions now. The question on the single 1-point question on what delivers blood to the myocardium, it was missed by some people. I'm a little surprised. So let's think about it. What delivers oxygenated blood to the circulatory portion, the systemic portion of your body? What? Arteries or veins? Which delivers oxygenated blood? Arteries. What delivers deoxygenated blood back to the heart from the systemic portion? Veins. So if you might have selected veins, maybe you were mixing it up with pulmonary circulation is all I could assume.
Can you read that question?
The question was, what delivers blood to the myocardium? It had a little bit different phrasing, but what delivers blood to the myocardium?
So I'm pretty sure I was one of the people that got it wrong, because I put coronary, or I put veins, because when I was thinking myocardium, I was thinking the muscle of the heart, not.
So what delivers blood to the muscle of the heart?
See, when I was thinking it carries it to, I was thinking veins, because it's carrying it to the heart.
Okay. So what
But
supplies
that's
blood
coming back
to
to-
the muscles of the heart?
Yeah.
Like the question becomes, if you think about the heart as the pump,
Right.
the heart is the pump, but the myocardium is the muscle layer of the heart that has to have its own oxygen supply.
Yeah.
Advocating. Go for it. I'm listening.
No, that's why.
I see what you mean.
Yeah,
I see
that's
that
what I
you're
was
thinking
saying.
about how it was delivering it within the chambers of the heart, but it
Right.
wouldn't be to the myocardium.
Right, I just mixed those two up.
Get it? I understand your kind of point of view. Chambers of the heart. All right. I think that your understanding of cardiac output was very, very mixed. In that there was a question about cardiac output. Now here was the nuance of the question. It wasn't an except question, E-X-C-E-P-T. So you had to do a process of elimination, right? 4 of the answers would have been correct. 1 of the answers would have been incorrect. And I think that inherently, I can tell you right off the bat, students in all of my courses seem to struggle with the ones where they have to eliminate the negative. So your process of elimination and your test taking strategies might be the area to focus that my thought is that students don't understand the factors that influence cardiac outcome. That is what I take from the way it was answered. It wasn't like everybody was picking one or the other and it was like a close call. It was like everybody picked all these other things. And when I look at the other choices, I have no clue why you would pick those choices if you were reading the question correctly. So again, I'm gonna voice this as just a broad recommendation that you're taking time, you're utilizing your scrap paper. Anytime you see an all of these but or an except type of question, you are taking the time to remember what you're being asked. Maybe even rephrase it to yourself. Now, I am not going to get rid of these. They are not going away because you don't do well on them. In fact, they'll probably be more because you don't do well on them. And ask me why. Somebody guess why.
They're on the NCLEX.
They are on the NCLEX. They are hands down what you need to be successful. So I'm not taking them away from you to make your lives easier. I'm going to help you get through it and get better at them. That's my goal, okay? So if you struggle with these ones a lot, which I'm telling you right now, a lot of you struggle with the alls or the negatives. It just seems to be the thread. You need to reach out to Ms. Gretchen, Student Success Center. You need to attend the workshops. There's no excuses why not. You need to be coming and talking to her about how can I best learn how to handle these. You can work with me, I'm happy to, but you have that resource and it is your responsibility to get better at these if you want to pass that NCLEX, if you want to pass your classes. So, there you go. What do you guys have? You have questions on it? These accept questions kick people's butts. So I think the real big thing is taking your knowledge. Each and every one of the possibilities you could have reasoned through. In fact, you'd have found out that 2 of the 3 possibilities were completely impossible. Like impossible. If you had understood them, you would never have chosen them, yet 4 people chose them. So it may have come back to a poor understanding, but I'm more concerned that maybe it was missing how to read the question. Does that make sense to you guys? I've talked through with Dr. Higgins this morning. So she said to me, she said, rather than award points, there's one question that the whole class didn't perform as well on, and she said, rather than award points, the better thing to do is reteach. Because if somebody can get it correct, the possibility was there. Should I award any points back if one person gets it correct? I have a hard time making that decision. Doesn't mean I don't have a brain that says, okay, well, can I do? And so I reason through every set of them. But if someone can get it right, it was always possible. Okay? All right. I think there's a little bit on chemistry, going back to activation of an action potential. It was missed, but not at a high rate, but some people forgot the basic principles of depolarization of a membrane. So that would definitely be something if you know you struggled on, and anybody, I'm gonna talk to you about the process of review. There was one question about the branching from the aorta, vessels, the first vessels that branch from the aorta. Man, that question got answers all over the place. Again, if you guys had all just, I'm gonna go grab the figure. If you had all just immediately picked one versus the other, I would have said, well, okay, I can consider it, but people pick so many different things. So ask yourselves right now, turn to your peer, reason it through, and you guys as a class come up with it. What are the first blood vessels to branch from the aorta? Turn, and then you guys tell me. Trying to look at the picture, see if I can find you a figure in your text. No, these ones, what are the first vessels to branch from the aorta? Not, those weren't even the possible choices, so think, go specific. Looking at the heart here, looking at the branches. You guys don't even need to get stuck on your textbook either. Think about what I told you in class. I said it out loud. idea for me?
According to the book, it would be the carotid.
Next. What receives blood flow very first? What is the most important thing that your body supplies blood flow to?
Your heart.
So those of you that selected coronary arteries would have been correct, because I can't remember how many times I said it, but the first most important set of blood flow to the, and yes, it is the aorta, it is the base of the aorta where they branch.
No, because you know I always get confused.
Yes, ma'am.
Yeah.
Yeah, I think that might have been what got some people on that other question. But on this one, the choices are definitely branches that you see, but the first branch is the real question. And I think we need to remember how important it is to resupply blood flow back to the heart. The heart itself gets the first most oxygenated blood. I think I said it 4 or 20 times. Like, I don't know how many times I said it to you, but I can tell you hands down that I pointed out, I even grabbed the picture, the image of it, and showed you where they received the initial blood flow. So the first one will be your coronary arteries. And why? You guys tell me why. If it doesn't take care of itself, this whole thing breaks. So it takes care of itself first and foremost. And I said that exact thing. So again, just making sure you guys got it. I don't want you walking away not. A few of you missed cardiac tamponade. I'm a little surprised at it. A few of you put pericarditis. I think it's time that you go back and review some of the medical terms from your chapter. Somebody picked pleural effusion. Again, really, really important that you know the difference. We're going to learn about pleural effusion in 2 chapters. So if you pick pleural effusion, if you don't know what pleural effusion is and you picked it anyways, again, maybe up for review. Pericarditis kind of throws me. I was a little surprised that anyone would pick pericarditis when it talks about fluid in the cavity, but when we see that term itis, what does that usually mean? Any kind of itis, it means an inflammation. So when we think about something where we're talking about fluid, it doesn't equate to inflammation. So that might be a helpful tool moving forward. Okay. Let's see. All right, so 2 EKG questions to mixed success. Some got it, some didn't. If Dr. Higgins could tell me one thing to make sure the students walk out knowing, it would probably be the meaningful importance of cardiodynamics, followed very closely by how to interpret the basic principles of conduction of the heart. Okay, so she'd tell me cardiodynamics first because you're going to be worried about cardiac output in your patients, and then she'd tell me any time that an individual can tell me the conducting system. So I don't know what a nurse would rank. Every nurse would rank, but they put them like right on the same level of importance. So if you were struggling with conduction in the heart, EKG, or any of the principles with it, take some time, go back. Don't leave this body system and then hit final exam time and have this still be an area you don't understand, okay? All right, let's see. Then we had to worry a little bit about pressure, and I will tell you when it came to chapter 21, it was like not all questions were successful. So pressure, a few principles of pressure. If you don't understand blood pressure or what drives the pressure of blood through your body, it's time to go back. Again, don't leave this system completely behind in your memory without revisiting. The turbulent blood flow question, more of you got it correct than not, but what was interesting is a bunch of you stopped at saying that turbulent blood flow would occur only where there are irregularities to the vessel wall. But what do we know? If there's irregularities to the vessel wall, it'll cause a spinning. It's kind of, you hit turbulence in the air on an airplane when you run into irregularities. But when else might you have things that can swirl? You ever watched a lazy river? I have. When you have like a little stream and it's going slow, the water starts spinning side to side. When the flow is low, turbulence can occur. When the vessel walls are humongous and the flow is low, that'll influence turbulence even more so because you got a whole lot of space and things not moving very quickly. So some of you stopped at one thing without considering the possibility of the others. It was an all is correct question, and many of you stopped at just part of it, and your answer is correct, but so were all the rest. Okay, let's see. Some of you, there was not it wasn't, more than half you got it correct, but when it was actually what holds the largest percentage of blood supply in the body, some of you were mixing up arteries versus veins. Where does the majority of your blood sit? In your venous system. A lot of you went with arteries. A few of you went with capillaries, and I think it's time that you take some time and review back those vessels, okay? Oh, and then here's the big one. The big question that was missed was purely a definition question. And it was, and this is the one that was missed to the highest amount, and it was related to blood pressure. And the question was to define the types of blood pressure. The only ones I think that might have been understandable was people, what is the definition of pulse pressure? That's the question I want to ask you. What is the definition of pulse pressure? Okay, so how do we, not exactly, close though, not. Difference between systolic and diastolic. Difference between systolic and diastolic. And if you need to know that, I can find the page, because I was sitting on it earlier and I said, could there have been any chance that they could have had any other valid argument to this question? And I wanted to give you the benefit of the doubt, and then I looked at the definition, found, I'm sorry, I had it open in the back. There it is. The definition is found, for me, on page 738, which would be your same page actually, but it is found in section 21-2 under arterial blood pressure. The difference between systolic and diastolic pressures is the pulse pressure, period. That is exactly what your textbook says. So if you selected anything but that, it's time to go back and review what mean arterial pressure is, what blood pressure, what we commonly term blood pressure is. And so when you guys put blood pressure, when a bunch of you put blood pressure, I said, but that's not the definition, right? That isn't the actual. So I would have understood putting blood pressure on an initial until you realized that it actually asked you the difference between the two. It didn't ask you what the measure of it or how to measure it, or it asked you specifically that. All right, guys. Now tell me one more thing, and then we're done with our review. And then I will talk to you about the process. When blood moves through your veins, what are factors that moves blood through your veins? Let's list them. So, in our veins, what muscle is contracting? You've got a calf muscle, you've got a vein that runs through it. What muscle is contracting? The smooth muscle on the wall here? Why not? So you were talking about skeletal muscle compression. Okay, so skeletal muscle compression will help move fluid through veins. What else will move fluid through your veins? So the valves will keep the backflow from happening. So we know that the valves will keep the backflow. And that was a part of one of the questions. But if you read it, you would never have picked this guy, okay? And so you're correct. You're correct. No, it's not wrong. Some people put valves and veins preventing backflow. Yeah, you're correct. That is one thing that does. When it comes to the pressure, what are other things that drive fluid into the blood? What's up? No, that's the point of this right here. So I'm not gonna. Let's think about it, guys. That is the point of what I'm doing. Yeah, you wish I would, right? But unfortunately, no. I'm trying to see what you know. The pressure in the veins is lower than the arteries, so we know that that's going to drive the pressure fluid up, right? So pressure is an important thing. So pressure in veins greater than pressure arteries. What about the smooth muscle on the What about the smooth muscle here on these veins?
You're wrong.
Arteries
pressure than that.
Pressure in the veins, yeah, so, okay, sorry, I'm reading the negative question. Sorry, you're right. How about the smooth muscle here in these vein walls? Why not?
Cause it doesn't contract the way that it needs
Is
to.
there smooth muscle in those vein walls?
No. I
So, if you had seen the option of smooth muscle, you should have said, they don't have it. They don't, what? And that would have thrown all the other possibilities into righteousness, correct? Yep, y'all need, that was purely, there was some, like tunica intima questions, like there was, the two questions, one was tunica externa, the other was tunica intima, and then if you tunica media. Those ones made me again kind of question whether or not the anatomy of the vessel was maybe an area for review. Okay. So that's it. I'm not looking anymore with as a whole class, but you guys are all anxious and excited. Fine, great.